Very important question, and the appropriations effort is being led in an incredible way on our side by Rosa DeLauro, partnering with Patty Murray on the Senate side. And House and Senate Democrats have been clear, including in our conversation with President Trump on Monday, that we want to reach an agreement in good faith to make sure that the government is funded and that we do it in a way that lifts up the quality of life of the American people. But we also have to make sure that if we reach an agreement that has bipartisan support in the House and in the Senate, is signed into law by President Trump, that the administration can't then come behind that agreement and in a partisan way undo funding for programs and for support that matters to the American people. And we've articulated that to them very clearly, and also laid out that in the Democratic continuing resolution that would keep the government open for 30 days, that resolution can be passed right now. The reason why Republicans consistently have voted it down is because the Democratic spending bill actually supports the health care of the American people, and Republicans are consistently voting to undermine the health care of the American people. Yep. Yep.
This is just the first day of the shutdown, but I'm curious how you're thinking about its impact on the midterms.
We are not thinking about its impact on the midterm elections.
How much of this is about showing not just your voters, but the public, that you guys are willing to stand up to President Trump, the administration, and the sort of abnormalities of his governance versus just the narrow demands about ACA subsidies and Medicaid funding?
I would disagree with the premise of that question. The health care of the American people is not a narrow demand. It's central to their quality of life. Mike Johnson in the Oval Office meeting kept saying that health care is an extraneous issue. And I had to make clear, excuse me, the health care of the American people is not an extraneous issue. It's central to their quality of life. Central to their quality of life. Children, older Americans, people with disabilities or chronic illnesses can die. Here in America, the wealthiest country in the history of the world, in the absence of everyday Americans having access to the health care that they need and deserve. The health care of the American people is central. Now, there are a lot of other challenges that we have to confront with the Trump administration, including, of course, its assault on the economy and the failure of Donald Trump and Republicans to actually lower the high cost of living. But that cost of living challenge is also central to the fight that we are having right now on Capitol Hill. Because healthcare premiums, copays, and deductibles are about to dramatically increase for tens of millions of Americans of every race and every region and every religion in this country. It's going to dramatically increase in an environment where America is already too expensive. And we can't allow that to happen. And time has run out in terms of Congress taking the steps necessary to extend the Affordable Care Act tax credits. Republicans keep delaying and delaying and delaying. Why? Because they don't want to provide affordable and accessible and high-quality health care to the American people. That's the Republican position, and it's been that way for a long period of time. It's the reason why we can't simply agree to have a conversation with the Trump administration or Republicans about the Affordable Care Act. Because why in the world would we trust these people, particularly as it relates to the Affordable Care Act, when they've been obsessed with killing Obamacare for the last 15 years? And because the American people have aggressively pushed back, they failed. repeatedly, but that hasn't stopped them from continuing to try.